Hello. Good evening, everyone. Welcome, welcome, welcome. Welcome, everyone. I just want to type in a message welcoming you all. If you're there, send me a message. Let me know you're live. So exciting to have you here. Send me a message. Let me know if you can hear me. So today we're live on YouTube. So good to have you here. So if you have, please share the link. Share the link with friends. Let them know that Dr. Joni is live. We're live. Send me a message. Let me know. If you can hear me. Okay. So good to have you here. Okay, so if you have a question, you can chat me up. So good to have you here. Good evening, everyone. Welcome, welcome, welcome. Oh, wow. Eagles Business School. Good evening. How are you doing? So great to have you here. All right. So this is an exciting topic. Please, I want you to share. Please share the link. Share the link with family, with friends, with your important better half, Just share with them and let them know that, we're live. Okay. Let them know that we're live. So today we're going to be talking about something really, really exciting. How couples can support each other, in terms of oral health. And this is something, Mr. Layemi, good evening. Great to have you on. Please send me a chat. Let me know. Let me acknowledge you. Okay, so we're going to be talking about how couples can support each other's dental health. And I think it's really, really, really important. Really, really, really important, that we talk about this topic. Very, very important, okay? So we're just going to go ahead and start, yeah? Because I'm really, really super excited. I'm charged up tonight. I hope you are. Okay, so as you all know, this is February, is the month of love. Valentine's Day. How did your Valentine's Day go? How was it? Did you celebrate that Valentine's Day? What did you give as a gift? I know a lot of people will do roses, chocolates, and a lot of things. You know how I feel about chocolates already. Anyway, I'm not saying you can't have your chocolates, but when you do the chocolates thing, you also have to think about the oral health. Okay, after it, yeah. Yes. Okay, so how many of you actually did give a gift like scaling and polishing for Valentine's Day? That's a fantastic gift to have given to someone, especially because we're talking about how we can support each other as couples in our health. Okay. All right. So why is this topic important? If you've been following me, you know that I would always say that your general health is not complete without your oral health. No, it's not complete. Okay, you can't talk about wellness without talking about oral health. Okay, because WHO clearly states that wellness is not just the absence of disease. Okay, but it has to do with everything functioning well. I don't want to bore you with definitions, and that also includes oral health. Okay, oral health is so important. I mean, if you've had a toothache before, you know that in fact you can't really function. Or if you've had something, if you have pockets, periodontal pockets. So ideally, the gums are supposed to be tight around the neck of the tooth. But when you have food getting stuck in there, I don't know how many people that happens to. You eat meat and the meat gets stuck in between your teeth. And then some of you that are looking at me, you're using toothpicks. Or once the meat gets stuck in there, you're so uncomfortable until you floss out everything, you don't feel okay. All right. It can really give a toothache, especially if the particles of meat stays in there for longer than necessary. Okay, so it's really important, but you won't be able to function. You won't be able to do anything. Just want to find anything to get that piece of meat out of that place. Okay, so it's important for us to care about our oral health. But I think it's more important if we do it as a couple, supporting each other. And like I rightly said, there is a great connection between your oral wellness and your general wellness. And studies have shown that there's a link, because we're talking about couples now, between oral health and infertility issues. So if you're on this, session tonight, I mean, it's something to look at. It's something to look at, especially if you're married and you're trying for children. There are studies out there that have shown that there is some link between oral, poor oral health and infertility issues. Okay, so it's something to consider. A simple thing like scaling and polishing can go a long way, And then, of course, studies have also shown that poor oral health is actually linked with, heart disease. And I know that as couples, we want to do everything together. We want to have our spouses, our better halves, our left ventricles, or whatever it is you call them, for a long time to come. We need to, and the truth is that couples who do things together, who take their health goals seriously, who encourage each other, there's a tendency for you to achieve those things because it's some kind of accountability. So there's a lot of link between oral wellness and your general health. Okay. And like I said before, I've seen a lot of cases over the years. I remember there was this elderly woman that came in, had teeth that were shaking. She had what we call periodontitis. Her teeth were shaking. She had some pus coming out of the socket. She just said that she just feels like her mouth doesn't smell fine. She came in, a bit of bleeding, of her gums, and then a bit of pus coming out of the socket. And she didn't even know that she had diabetes, because you see, diabetes or sugar in the blood can actually manifest itself orally. And so when she came in, we had to send her for those tests. And then we found out that, she had a high blood sugar level, and that was affecting everything, affecting everything. So it can actually manifest in the mouth. A lot of conditions can manifest in the mouth. And just by simply coming for a routine dental check, some of these things can be nipped in the bud. Okay. If you are anemic, for example, do you know that it can manifest in the mouth? Yes, it can. Your tongue will not be as pink as you should. If you look at the mucosa, so every single thing, because the mouth is a mirror to the body. I mean, I can't, overemphasize that. It's so important, And then, of course, because we're power couples, we're thinking of succeeding at work. Okay, does your spouse have malocclusion? I have seen some people, especially people who are into sales, they are trying to sell their products, sell their services. Some people have, not been taken for a contract, because their teeth are not properly arranged, or shall I say that the teeth is scattered. Okay, so if you're somebody who has a spouse who that you want them to achieve and be more confident, because studies have shown that people see your smile before they see you. So a smile is something you put on. It's like putting on perfume. It's like putting on makeup. I mean, why do women put on makeup? They just put on makeup to enhance their appearance, to look good. because you see, beauty is in the eye of the beholder. Some people, so studies have shown that when you walk into a room, the first thing that people see about you is your smile. They may not even see the color of your lipstick, if you're a woman, for example. And those things have gone a long way to affect, career goals. And so somebody is not able to sell a product just because of the way their teeth looks, maybe scattered, or they have a lot of gaps. I mean, I got a DM recently and somebody was telling me that, oh, doc, what can I do when I'm talking? I feel like spit is escaping from my mouth, So you can imagine somebody who has come with your spouse, has come to a meeting with a powerful proposal. He wants to close that deal or she wants to close that deal. And then she's talking, like this person just messaged me and spit is coming out of their mouth. More often than not, these things can happen when you have gaps in between your teeth. So you're talking, spit is escaping, or sometimes if you have a lot of gaps, it can actually affect speech. And so you are giving a powerful proposal. And these days we're doing a lot of virtual. We're doing virtual. Since COVID, everybody's doing Zoom, Google Meet, you understand? Like we are live right now on YouTube. And you're talking to maybe some foreign partners. You have a great proposal and you're talking and they can't hear you. Because you see, the tongue makes contact with the teeth to produce speech. And then they'll be telling you, oh, sweetheart, I couldn't close that deal. The people kept saying, pardon, we can't hear you. Things like that can go a long way to affect people's self-confidence. So if you have a spouse that has any of these things I'm talking about, encourage them to come in and have a routine dental checkup. We're going to be talking more about that. And then, bad breath. Bad breath is something that, I get a lot of questions about bad breath. Okay, so we're just talking about the importance of oral health to our general well-being, even to our mental health, like the scenario I just painted. You can imagine somebody who's drawn up a great proposal, you're good at what you do, and then you walk into this place with all the confidence and you're talking and spit is coming out. It can dampen your morale. Or you're talking and you feel like everybody's looking at your teeth, okay? And you're not able to close those deals. It can affect your mental health, it can affect your self-esteem. So it's something to really do something about, okay? So it's really, 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 really important, all right? So, I've painted so many scenarios, all right? But as couples, very quickly, I want to talk about how we can, encourage each other to build, a good oral health value or oral health together, because doing it together, if you have some form of accountability, it goes a long way to help. Just before I talk about that, we need to, one of the things that we can do is to build an enabling environment. Okay, so you have a spouse. I remember some years back, there was this young man that came to see me, and he had just been married. Okay, and I think it's something that had been a problem. Bad breath. I was talking about bad breath recently. It is something that a lot of people find it difficult to tell someone. I've talked to so many people, and they tell you, I have a friend whose mouth smells really bad. I don't know how to tell him, how can I just tell somebody, guy, your mouth is smell? It's something that is really, really difficult for a lot of people to do. But you see, as couples, because we're building together, okay, and this person's success is your success. So there are ways that you can go about it. Maybe you don't want to hurt the person's feelings and all of that. Like I will always say, the causes of bad breath, 90% of the time is the mouth. So if you have a spouse or you have a fiancé, a boyfriend, a girlfriend, your partner that has bad breath, one of the ways that you can just say it is like, okay, dear, let's go and do scaling and polishing. I've been listening to Dr. Joni, and she said, we should do this thing every 6 months. Have you ever done scaling and polishing? And then maybe the person, she tells you, I've never done. Or you say, even me, I've done, no, but it's been a long time. Let's schedule one. Let's go to the clinic. Let's schedule this scaling and polishing. That's another way. So you get there, you get them in there, and then they do a routine dental check. Because really, if you have bad breath, it's something that when you come in for a dental consultation, It's something that can be caught, that can be diagnosed, and then the possible causes can be highlighted, when we do that dental examination. You understand? Can light everywhere, like I would say, and know what the cause is, because 90% of the time the causes are in the mouth. I mean, that reminds me of a story some years back. As I was just saying, this young man got married and his wife scheduled a dental examination for both of them. And then when he came, he came to see me. He said, that his wife said, he should come and do checkup. He has never done scaling and polishing, and she said he should come and do scaling and polishing. And if I remember very well, I think she paid. She was like, let me spoil you small, since you've never done scaling and polishing, and he came, and then we got talking. I actually asked him, I said, has anybody ever told you that you have bad breath? He said no, but that most times his wife would just tell him, maybe later in the evening when he's back from work, he say, honey, have you brushed? So he said that the way she asked from time to time, honey, have you brushed? When you brush, did you brush your tongue? That he knew that something was wrong. Okay. And that even at work, he noticed that sometimes, he's talking to some of his colleagues, some of them are moving back. He feels like as if they're holding their breath. And then some of them are using style to pinch their nose, they're pinching it small. That he knew something was wrong, but he didn't really think much about it. But by the time he got married, and from time to time, his wife would tell him, honey, have you brushed? Honey, did you brush your tongue? And then she scheduled them a dental appointment for both of them. He knew, nobody had told him. His wife didn't tell him because she didn't want to hurt his feelings. So I told him, I said, wow, let's start with scaling and polishing. Because he had never done scaling and polishing, and the oral hygiene, he had a lot of calculus everywhere. And you see, like I always say, these things, they're remnants of food that become hard. They have bacteria in them. They lead to accumulation of more plaque, and this can cause bad breath. Honestly, this can cause bad breath. Okay, it can really, really cause bad breath. All right. So, and when he did that scaling and polishing, believe you me, he came back and said, wow, that since he did that, he has not noticed anybody doing all those things to him, like pinching their nose, moving back, and all of that. That he didn't notice it. I mean, that's a way that as couples we can actually create an enable environment and encourage each other. Yeah, encourage each other. So that's what that guy's wife did for him. All right, so let me know if you can hear me. I want to be sure that my network is stable. Please let me know if you can if you can hear me. If you can hear me, send me a message so that I know that you can hear me and I'm not just talking to myself, right? Yeah, great. So, so those are some of the things that we can do. So we can schedule a dental appointment together. Okay. Oh, great. Thank you. Loud and clear. Wow, fantastic. So that was one of those things that they did, schedule dental appointments together. Okay. So, oh, great. Oh, thank you. God's will divine. Okay. So that guy, his wife did that for him. And in all honesty, he told me, said, wow, doc, that he'll be scheduling this appointment regularly, that, he feels better, he feels more confident. People are not pitching their nose with style, and doing backslide and holding their breath, when he's talking to them. He experienced a great change. Okay. And that's one of the ways that as couples, we can encourage, like, create an environment. Now, the other thing is educating ourselves. Okay. I mean, like now you are on this live. It's something that you can share with your spouse, share with your. Hi, can you hear me? Yeah, I think I'm back. I think I went off briefly, but I'm back. Okay. So, yeah, it's something that you can schedule with, your friends. Telling them about what you've learned. Like, for example, you heard about this session. It's an opportunity for you to like tell your spouse, oh, Dr. Johnny is doing something, any new thing you learn, you can educate your spouse about it, so that way they're more knowledgeable. And for me, I always believe that when people do better, when people know, oh, thank you so much, thank you. So when people are aware, when you're educated and you are aware, you will do better. Like for example, I did a post recently on scaling and polishing. Spitting of blood is not normal. And to my amazement, a lot of people didn't know that it was not normal. Okay, so if you listen to that video, I think you should share it with your spouse. That's an excellent way. That's an excellent way, of educating them. So when you run into things like that, you can share with your spouse, because the more knowledgeable they are about oral health, the better they will do. The better they will do. Okay. So then, of course, also creating an enabling environment. For example, maybe you've gone to the dentist and, or you listen to some of my videos and I talked about toothpick. That toothpick is like digging, a grave in between your gums and your teeth. And that even though it's removing the pieces of meat that you enjoy, like, I just went to one bear this evening. Somebody did a birthday and we ate meat. Meat was really big. And then you now have pieces of meat in between your teeth. And then the next thing, you just grab one toothpick, because I know they give it a lot out at parties. But we're coming for them. We're coming for them. Yeah. And then you use it to pick out the meat, and you feel, oh, doctor, nothing works. Like, I remember there was this elderly couple that came to see me, and the man was like, I just need to use toothpick. Nothing works. So one of the ways that his wife tried to like encourage him to stop these things was that she doesn't buy toothpick in the house anymore. Okay. She buys placards instead, because he complained that, doctor, I can't be rolling rope and doing like this, like I'm sawing wood, in an open place. Very, very fantastic, couple. And she bought placards instead of toothpick. She no longer buys toothpick in the house, because they've been educated while coming to the dentist, and they now know that toothpick is a no-no. Okay, so one of the ways that mommy has tried to help daddy is by not buying toothpick in the house. That's one way. Creating an enabling environment. If you know that your spouse would like to dig with shovel, with toothpick, you can decide not to buy it in the house. Okay, so I'm just giving you little tips like that. So, and then she also went out to buy a water flosser. Buy a water flosser. The water flosser is like using water to rinse in between your teeth. Okay, so the floss, maybe a placard, water flosser. So she's done all those things to create an enabling environment. And I tell you, it went a long, long way to help. Okay, it went a long, long way to help. So I've talked about scheduling visits. I've talked about educating ourselves. If you hear anything new, you can share it with your spouse, so that you're not the only one getting educated. They can also know what to do. Like I'm telling you now, it's so important. Your oral wellness is directly related to your general wellness. Okay, you can schedule an appointment for SMP. Like I told you about the young man, he had bad breath. The wife was just telling him stylishly, honey, have you brushed? Did you brush your tongue? But when they scheduled an appointment for scaling and polishing, and she came along with him, it was an opportunity for us to talk to him about the bad breath, do scaling and polishing, teach them how to brush. Okay, so it was something that, and then another thing he said was that, after they had come in there, she would remind him, you have not brushed last thing at night. So remember, the doctor said that the brushing at night is even more important than the brushing in the morning time. And so that way they encourage each other. So it got it now became a habit, okay, for both of them, such that if she is tired, it's like, you have to go and brush. They said the brushing at night is more important than the brushing in the daytime. So we can encourage each other. Okay, like that. And then changing of toothbrushes every three months. And so sometimes what you can do is you can buy these toothbrushes, maybe a lot, well, not so much, maybe like 6 pieces or so in the house, so that when the brush has reached 3 months, you have to spare in the house, you can easily say, this brush everything is doing like this, is doing waka, is bending, is bowing down and doing a leg walk. And you can easily throw it away, okay, and let them have another one. So these are ways of creating, an enabling environment, creating that support, for your spouse and all of that. And then, of course, when they go to the dental clinic to see the dentist, one of the things I would do for you is that you would do a routine dental check. They will look at everything, and if there are things going on, you can become aware so does this particular couple, the man came in, his teeth were felt, no, I need to zoom. His does for him is that his spouse comes along with him to the dental clinic to give him support, and there are times when you have braces and maybe there's not enough space to align those teeth, and you may need to have some teeth taken out so that we can align the space properly. When he came in to have the extraction done, when he came in, okay, my network, oh wow, I wonder what's happening. Wow, wow, wow. Okay. Can you still hear me? Can you still hear me? Oh, great. Okay, it's better now. Great. Okay, so one of the things that the spouse did for him was that she came along with him. To have the extractions done. So like hand holding. Okay. So these and many more tips. Okay. Then another thing that we can do to support each other is healthy eating. Okay. I mean, if we eat right, we are what we eat. We are what we eat. I mean, and then of course, if you eat healthy, your mouth will thank you for it. You see, it's almost like as if a lot of us forget that the digestion actually begins in the mouth. That chewing of food, the grinding of food, and the mixing with saliva. So you can imagine if you don't have teeth. In fact, there's a study that I came across recently that said that some people, the teeth at the back are not touching. They're not touching. So the teeth at the back, especially coming together and touching and actually grinding and chewing that food, it goes a long way to preserve the health of your gut. Can you just imagine? I mean, the mouth is so important to your wellness, okay? Because the physical chewing and grinding of your food will help with digestion. I mean, just swallowing the food, there are no teeth in your stomach to grind them. For you to actually benefit from getting all the nutrients that you need, your teeth actually needs to grind that food properly. It needs to mix with saliva. So it's when the teeth is proper, I mean, the food is properly digested and broken down, okay, and mixes with saliva. That's when the digestion is complete, within the stomach, because it's grinded into a pulp. And then when it gets into the stomach, the acidic juices in there takes over. But if you just chew, you don't, take time to really chew that food properly and you swallow it down, digestion will take longer because your stomach is not meant to grind that food. So you see how important having your teeth are. So if you have a spouse that has teeth that are missing, especially as we get older, we really need those nutrients. So encourage them to come and have teeth replacements done. There are so many options. Okay, so many options. It can be explained to them. You can do a hand-holding session, okay, with them, walk them through, explain, because I'm telling you, especially if it's the man that has some teeth missing, by the time mommy cooks all his favorite meals, you just find that he eats one, he eats two. He's not eating anymore. Sometimes it may not be that he's lost appetite. It may just be that he's not able to chew the food properly. Okay. So, I mean, so many things that we can do for each other. So healthy diet. So you can encourage them to, if you have a spouse that is a sweet tooth, you can encourage them to stop and say, okay, how long can we go without sugar? Okay, you know you have a spouse that likes to drink all this mere. You can decide not to buy it in the house. Okay, you can encourage them by buying a big bottle. I remember there was some time I got a gift, a big bottle for water that had graduations on it, 9 a.m., 10 a.m. It's fantastic. You can do things like that. Encourage them to drink more water, because really 70% of our body, over 70% is water, and you just need to hydrate. And just keep telling them that the water is better than the fizzy drinks, is better than the carbonated drinks. So those are ways that you can encourage your spouse. Eating healthy, encourage them to stay off sugar. And then if you have a spouse, like I said, that is a sweet tooth, when you do that fun challenge, this is like fun ways now of encouraging each other, then you can have a treat. You can go on a date and say, okay, let's go somewhere fun, let's go and eat something. I mean, you've been able to stay off sugar for 2 weeks. Also like a kind of treat to celebrate their wins. Okay, I know that right now we're in the healthy of living. People are drinking a lot of acid virus, apple cider vinegar. They are drinking a lot of lemon water. I really want us to go easy on all these things. They are very harsh, very, very harsh for the teeth. They cause what we call chemical erosion. So if you have a spouse, you have health goals, you're trying to drink more smoothies and stay healthy, a lot of all those things, you can do them with a straw. Okay, so you can buy straws in the house, or you can go out and get cups that have straws. That's another way of encouraging each other to still eat healthy, but maintaining good oral hygiene. All right. So sometimes you may have spouses that have objections, okay? Objections to coming to the dental clinic. One of them may be dental phobia. Dental phobia. I remember some years back, there this couple that I saw. They were a bit elderly, maybe like middle age thereabout. And the woman would come, okay, and have something done. And the man will accompany her there, but he will just sit at the reception. So I think he had some issues with his teeth or thereabout, and he didn't want to come. And eventually we found out that he actually had dental phobia. So one of the things that the spouse does is accompany him to the dentist. And so while they're sitting at the reception, they're gisting. That's a fantastic way of helping solve dental phobia or dental anxiety. They're just anxious. They're afraid to go to the dentist. Maybe either they've had a bad experience as a child, and this, the truth is that many times people that are afraid of coming to the dentist may not really know that they are afraid. And then some of them do. So one of the ways that we can support each other as couples is that when you know that this person is afraid of coming to the dentist, you can schedule the appointment the same time with them, okay? Or just come with them for hand-holding session. So what they used to do, what she used to do was that she would come with him. They will sit in the reception and they're gisting, So while gisting, it takes his mind off whatever it is we're coming in there to do. And then, of course, when they come into the surgery, I mean, you're allowed to come in with at least one person. So she comes in with him. And then, the support is there and all of that. I remember there's another couple that I know of. The wife had, issues, dental issues. Her husband was so supportive. Of course, she was afraid. And she didn't really admit it. She had been running away for so many years, and he had been encouraging, and eventually she came in. She had all that dental work done. So anytime she scheduled an appointment, he tried to be there with her, and then he would hold her hand, he would talk to her. In fact, there was one time he would massage her feet and tell her, babe, you can do this. So that's another way of us showing support. If you have a spouse who is afraid of coming to the dentist, that's one way that we can, help them overcome their objection to having dental, work done, because they're anxious and they are afraid. Those are some of the reasons why they may not want to come. Okay, people might just feel, it's too expensive. Dental, this thing is too expensive. And I always say to people that, look, Dental health or dental care is not expensive. Ignorance is. Oh. Ignorance and delay is. Another instance. So say, for example, you come in, you schedule a routine, 6 months scaling and polishing. And trust me, before you do the scaling and polishing, we'll do an examination. We'll look around, see if you have any cavities or anything that is going on there. And then you become aware. You become aware of these things. And then if you have a hole, for example, because you see, when you have a hole in your tooth, it's not like when you have a cut on your skin. The skin can heal itself and the wound will close up. But if you have a hole in your tooth, the hole is there. You know, it's like having a hole in the wall. Until we plaster that hole, the hole is there. And that's the way a feeling is. So you have to come in, we have to remove all the remnants of food and debris and dirt that's inside the hole in your tooth. And then we now fill it up with tooth filling, just like how we use cement to cement the wall. The material is same color with your tooth, okay? So we have to do that. But you see, if you run away, you stay away 1 year, stay away 2 years, stay away 3 years. You see, once you have a hole, the hole only gets deeper and deeper. And then eventually, because teeth is in layers, it will enter into the center where the nerves and the blood vessels are. It just enter, and then one day you have so much pain, you won't be able to sleep, okay? And even if you had one major contract the following day, you won't be able to go for it. It can actually impact productivity, okay? And then you have to come in, and when something that would have been a simple feeling now ends up being a bit complicated, something like a root canal, and then you now have to have a crown on it, okay? So it would have been cheaper to fill that hole than waiting for it to degenerate or get worse, and then you now end up doing a root canal. So choose your choose between the devil and the deep blue sea. Choose your choose, or choose your choice, anyone you like. But you have to, you know. So a stitching time actually saves 9. Yeah. So I've been talking about how we can encourage each other as spouses to have great oral health. So I don't know if you have any questions. Please ask me. You can drop your questions in the comment section, and I will be more than willing to answer them. All right. Do we have any questions? Questions in the house? Questions in the house? I mean, I could go on and on, but I really want to. Yeah, I really would like us to ask questions. So if you're new on this call, thank you so much for joining. I'd like you to subscribe to our channel. I mean, if you subscribe, this will give us the ability to provide you with better content, give you quality, and educate you about your oral health and give you value. All right. Thank you so much for joining. Please subscribe, like the link, click the notification button so that when we have live sessions like this, or we put up any videos or anything, you would be able to get notification that our videos are up, okay? And you keep learning and learning. You know, I mean, it gives me a lot of joy. I see people say, oh, wow, you know, somebody sent me a message the other day and she said, I always look forward to your videos, ma'am. I so much from them. Thank you so much, and God bless you. God bless you too for watching, for liking, for sharing. All right. So I'm waiting for your questions. I'm waiting for you to ask me those questions. Okay. Please ask me questions. You can share. You can also share with me experiences. I mean, I'd love to hear your experiences. You know, how have you been able to encourage your partner to imbibe good oral hygiene practices? You know, please share with me your experiences. You know, you can drop something in the comment section. How have you been able to help them? And I just told you about that young man that the wife just came in, honey, have you brushed? You know, did you brush your tongue? And then she scheduled scaling and polishing for both of them. And I mean, that was the beginning of solving his bad breath issues, you know. And the truth was that he knew something was wrong, but he didn't really know what it was. So you can share with me your experiences. Please share with me. I'm here to listen. How you have been able to support your spouse or encourage them to take their oral hygiene seriously. Share with me, please. Yes, 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 yes. I'm waiting. I'm waiting. Nobody has anything to share with me. Share with me now. Please share with me. Mr. Liami, do you have anything to share with me? Maybe something that how you've been able to encourage your spouse. Mm-hmm. Okay. So that's it. We can anybody want to share with us tonight? I'm still waiting. Anybody want to share with us? Okay, so I'm going to say it again. Thank you so much. If you're new here, thank you so much for joining us. I mean, this is our YouTube channel, and we're always delivering quality premium content because our goal is to create dental awareness, to give you a stunning smile and a healthy you, honestly, because like I always say, the mouth is a mirror, it's a window to the body. The mouth is a mirror to the body. There's so many things that we can pick out in your mouth just by doing a dental examination. Honestly, so many things. And if you have a spouse right now, maybe they're having, even if they're having like health issues like diabetes and all that, you need to schedule a routine dental checkup for them because diabetes, for example, okay, said the singles don't have spouse yet. Receive the spouse in Jesus' name. Okay, so but it's good. I mean, you can use this to educate yourself, and so that when that better half comes along, you'll be able to encourage them to go for it, to encourage them to go for it. Okay, encourage them to go for it. Yeah, I know of somebody who was dating, and her fiance encouraged her to do braces, because he just felt, I mean, not just for the wedding day, but I mean, I'm telling you, her smile looked stunning, looked really stunning on that wedding day, even though she wasn't completely done with the treatment. you know I'm sure you do know that if you're having braces done and then maybe you feel like, oh, maybe you're waiting and saying, no, let me wait until after the wedding day. You don't have to wait. Oh, you can go ahead and start. I mean, in as little as 3 to 6 months, if you're doing braces, you will see the difference. You will see the difference. I remember many years, um I think my network is a bit so I said many years back, there was this young lady who's before she got married, husband now, but he was her fiance then, encouraged her to have, sorry, I think my network is a bit unstable. Sorry about that. Yeah, so food gets stuck and everything. And I encourage her to do braces. And of course, within 3 to 6 months, I mean, the change was remarkable. Of course, it didn't stop her from getting married. She asked if she could take it out. She did. She took it out temporarily, had retainers done, in the interim. And then after the wedding, came back and put the braces back in. So don't let that stop your braces journey, please. Don't let that stop your braces journey. Okay, you can have that beautiful smile. 3 to 6 months, it won't be done yet, but 3 to 6 months at least, the difference will be like day and night. And you can have a great smile. So somebody said, I think a lot of us make use of charcoal to whiten their teeth. What would you like to say about this, Mama? Okay. Um, so the truth is that all this charcoal and all these things, they can be very, very harmful for the teeth. Okay, a lot of these pastes are quite abrasive. They'll say, oh, they're giving you whitening, whatever, whatever, but they're quite abrasive. And what they end up doing is that they end up, like peeling the enamel. They make it thinner, all right, and it can be quite detrimental. So I've heard people say they do a lot of DY apart from charcoal. Some people say, oh, I use baking soda to brush and all that. See, don't do all those things. Those things can be very harmful for your teeth. They can be quite abrasive, all right, for your teeth. If you would like to whiten your teeth, you can do it professionally. Please do it with a dentist, okay? And then not everybody is a candidate for whitening. I always say that not everybody is a candidate for whitening, because sometimes some of these things can thin out your teeth, especially if you have sensitive teeth already. It would make it worse. And then if you didn't, by the time they thin it out, you now begin to have teeth that are shocking. So for me, I would say use a toothpaste that has fluoride. People are concerned about the fluoride, but the truth is that the fluoride in the toothpaste is very minimal. It's something that is just enough, okay, to give you gets into when the fluoride gets into your tooth substance, okay, when it gets into your tooth substance, it strengthens it and makes it less prone to becoming areas or to having cavities or having holes, okay, in your teeth. That's what the fluoride does. So if you use fluoride containing toothpaste, fantastic. I do know that there are some toothpaste that are good for gum care. Even if you use those things, it will be advisable to still use the toothpaste that contains fluoride. So as much as possible, hi, can you hear me now? I'm so sorry. I think the internet network has been a bit off lately. Okay, but I'm back. I'm back with a bang. Okay, so that's it. I mean, that's pretty much it. Okay, so please use hi. So sorry. I think my internet has been acting up. So sorry about that. I'm back. I'm back. I'm here. Like I never left. Okay, so I don't know. Trust you got value. Trust you got value for tonight's session. I mean, we've done like 49 minutes already, and it's been a blast. It's been a blast. Although I didn't get to hear from you about your own, how you've been able to encourage your spouse to improve their oral health. Yes. I mean, one of the ways that you can do it is just, schedule a session, schedule a dental session. So my oh, great. I'm so glad you got a lot of value. So one of the things I'm going to leave you with is, have you ever done scaling and polishing? Have you ever been to the dentist? If you haven't been to the dentist, what is stopping you? What are your objections? What are those things that you are afraid of? Are you afraid of visiting the dentist? Maybe you had a bad experience as a child, or what are your objections generally? So I think one of the best ways to do it is to schedule it as a couple. Go in, let your spouse go with you, hold your hand, walk you through the process. And trust me, it's not what you think. Honestly, it's not what you think. We have a lot of friendly tools. I tell someone I have a lot of friends who are like, Nibo. But yes, we do have a lot of friendly tools. So come in, it's not what you think. I mean, I know that sometimes they say this is what the dentist thinks, but this is what the patient sees. But as you come in, you find out that it's not what you think. It can, and the truth is that you having that, scheduling that routine dental checkup can go a long way to improve your oral health. It will go a long way to improve your confidence, okay? And a whole lot of things. A whole lot of things. I've seen couples who come in together, who schedule appointments for each other. And the truth is that these things are also a way of building a bond, building a relationship that can stand the test of time, because couples who work together, power couples who support each other, I mean, it will go a long way to build your relationship. All right. So thank you so much for joining me tonight. And until I come your way again next month, okay, with another juicy, hot topic. So, like I said, thank you for joining on the live stream. This is our channel. Once more, I just want to thank you for coming. Please don't forget to subscribe if you haven't done that. Click the notification button so that when we drop all those juicy videos, all those educational videos, you will get notified that we've dropped something on this channel. Stay tuned to this channel because we promise to bring you exciting topics, interesting topics, informative topics, things that will help you grow, and improve your oral health. Until I come your way again next time, I remain Dr. Joni. Joan Agbanihena is my name, and I am committed to educating you about your oral health, because I strongly believe that your oral health is important, because your general health is never complete without a great oral health. Until I come your way next time, keep smiling, keep shining, book that appointment. The dentist is your friend. Thank you and good night. Bye.